there are a lot of people in India who are affected by this very lethal bone marrow problems. Bone marrow problems can be of various types. It could be leukemias, it could be other cancers like multiple myeloma, lymphoma. It could be a bone marrow failure syndromes like aplastic anemia, and sometimes some of the genetic disorders like thalassemias, immunodeficiencies. All this can affect the bone marrow. So bone marrow is disorders are basically identified when a kid or an adult comes to a doctor with certain symptoms, like it could be failure to thrive, it could be something related to symptoms of anemia in the form of easy fatigue, breathing difficulty, and sometimes it could be patient may be coming with just repeated infections. Patients could also be coming with bleeding disorders, and also sometimes they can just come with severe bony pains. As a hematologist, as a team, we do a detailed workup starting from the blood test, bone marrow examination, and other specialized tests to identify what kind of bone marrow disorder the patient is having. And finally, as a team, we give a proper treatment approach which the patient has to receive. Sometimes only the medications would work, and some of the bone marrow disorders are just treated with oral or IV medications, and some of the blood disorders, especially the cancers, may require further treatment in the form of chemotherapy, for which the patient has to be admitted and administered in the hospital. And certain types of blood disorders will require a high-end procedure called as a bone marrow transplant. Basically, there are two kinds of bone marrow transplant which have been done for these particular hematological disorders. One is called as autologous stem cell transplant, wherein we get stem cells from the patient himself. Other particular type of transplant is the allogenic stem cell transplant. We take the stem cells from the donor. So this particular transplant is done for high-risk blood cancers. Then we have been doing it for multiple myeloma, which is again one more kind of blood cancer. We have been doing for disorders like thalassemias, immunodeficiencies, and really it has been a boon for patients suffering from the bone marrow disorders.